A very good afternoon to all. Am I audible?
Yeah.
Yeah, thank you. Thank you. It's my immense pleasure to welcome you all for this webinar on the topic Building a Healthy Future for All, organized as part of the SBV Connect by Sri Balaji Vidyapith, Pondicherry. This particular webinar we are organized as part to commemorate the International Universal Health Coverage Day, which is celebrated every year on the 12th of December. And theme for the year 2022 is Build the World We Want, a Healthy Future for All. And the esteemed speakers for today's webinar are Professor Vijay Kumar M, Honorable Vice Chancellor, Yenapoya University, Mangalore; Professor Prabhashankar Shukla, Honorable Vice Chancellor, Northeastern Hill University, Shillong; and Professor Subhash Chandra Parija, Honorable Vice Chancellor, Sri Balaji Vidyapith, Pondicherry. I am myself Dr. Prahan Kumar, Professor, Community Medicine, Mahatma Gandhi Medical College and Research Institute, and I will be moderator for today's webinar. The topic for today's webinar, that is Building a Healthy Future for All, which is based upon the theme. All of us are aware that universal health coverage, this is one of the very key public health principle being implemented globally to achieve a quality and affordable healthcare services for all, everyone and everywhere. Back in the year 2012, during the United Nations General Assembly, the resolution was taken and all the countries globally were motivated and they were intimated to accelerate the growth towards achieving universal health coverage, which aims to attain a healthy state for all globally. And on 12th December 2017, United Nations announced that every year 12th of December will be celebrated as International Universal Health Coverage Day. This particular day is celebrated with the objective to create awareness regarding the need for resilient health systems so that we are able to achieve quality, equitable, and affordable healthcare services for people globally. And this webinar is dedicated for the same. And before we start with the webinar, I would like to touch upon few ground rules. I request all the participants to keep themselves muted. If anybody has any query, they can type their query in the chat box, which will be addressed later. So we will start with the webinar. It's my immense pleasure and honor to welcome our first speaker of the day. And I am honored to introduce Professor M. Vijay Kumar, who is the Honorable Vice Chancellor, Yenapoya University, Mangalore. Professor Vijay Kumar sir is an accomplished surgeon in the field of oncology, who is very keen in creating cancer awareness and health promotion. Sir was awarded the Fellowship of Royal College of Physicians and Surgeons, Glasgow in the year 2007, the Fellowship of International College of Surgeons in the year 2019, and also the Fellowship of American College of Surgeons in the year 2021. During the recently conducted 39th Annual Conference of the Association in India, Sir was awarded Honored Surgeon of the Year 2021. Sir has more than 70 national and international publications in various peer-reviewed international journals and more than 100 presentations in national and international conferences. Sir has been invited as orator for many occasions, including Dr. H.J. Mehta oration and Sir Dorabji Tata oration very recently. I heartily welcome, sir. It's my pleasure to welcome you. And we are really glad to have you as a speaker today. I request you to deliver your talk. Over to you. Thank you, sir.
Thank you for the introduction. And at the outset, I thank the organizers for giving me this opportunity to be a part of this program. A disclaimer, most of the ideas to be presented today are of mine and out of my thought process developed over a period of time when I was the director of Kidwai Cancer Institute, Bangalore. I was part of the team which initiated the health insurance scheme in the state of Karnataka, and I was the task force chairman of our oncology team which created the disease codes, investigation codes, requirements, and treatment policy. To refine and learn how to create guidelines, I was sent to UK in 2012 as a part of the Karnataka team to study the NICE guidelines and the NHS scheme. This talk is based on that experience for a period of 6 years, particularly during my tenure as a director. Share my slides. Today I have been asked to talk on a road to urban healthcare. I approached in my own way. Let us see at the end how it comes out to be. We'll start with the basics. Simple, straight questions I will ask so that we'll go to the actual keywords later. What is Ayushman Bharat program? Ayushman Bharat program is an umbrella health scheme which provides health insurance and also primary health care to the people of India, launched in 2018. It is the world's largest government-funded health scheme covering 50 crore beneficiaries. And why ABP was required at all, Ayushman Bharat program? The NSSO, that is the survey conducted at that 71st round, found out certain startling statistics. 86% of the rural and 82% of the urban households have no access to the health insurance. 19% of the urban and 24% of the rural households get finance through borrowing for the sake of healthcare problems if they are unexpected and more complicated. The National Sample Survey Office said it, based on which we have formulated certain things. What are the components? Two components we all are aware of. One is the health and wellness centers, and the other one is the Pradhan Mantri Jan Arogya Yojana, PMJ. To deliver comprehensive primary health care services to the entire population through the health and wellness centers. And the PMJ, it's also called as National Health Protection Scheme. Accessibility to the hospitalization services at secondary and tertiary level health facilities is taken care of. To understand a basic problem for our country would be the public health facilities. It is based on the hierarchy which you should understand before we go in deep of it. The population-based, the public health facilities, for example, the sub-health center will have one for every 5,000 population and 30,000 for every 30,000 one PHCs and one urban PHC for 50,000 and the community health center for 120,000. This is for general area with a little modified for the so-called difficult areas which are termed as tribal and hilly areas. As on 31st March 2020, this is the rural health statistics which came out suggesting the public health facilities function in India. There is 157,000 sub-centers and 30,000 PHCs, 5,000 plus community health centers, etc. But if you look at the next one, that is the Ayushman Bharat based health and wellness centers, current status, if you see the numbers, this is mainly because most of the sub-centers have been upgraded to the health and wellness center, and almost all primary healthcare health centers and the urban primary health centers have been redesignated as health and wellness center. The health and wellness centers are created to provide comprehensive primary and health care, including the child and maternity healthcare facility, non-communicable diseases, and advanced services, along with the distribution of very essential drugs. This is in gist, they have said it, and they have called it as comprehensive primary and healthcare. Instead of calling it as earlier, we were dubbing it as preventive and promotive to the primary healthcare. And now almost 12 points program have been included under the health and wellness centers. And that is how we moved from the preventive and promotion to the present status of health and welfare centers. If you look at the factors impacting the effectiveness and success of health and welfare centers, one thing which definitely will hit us and stand out would be the fund mobilization and cash flow, and the political will and the government's, both central and state government, willingness to support in order to sustain. This is the most important thing which we have to see, because the upgradation facility expanded in the health and welfare centers, whether they are really put into implementation, is one which we'll have to look into. If you just look at the SWOT analysis which we did for ourselves to know what is happening to Ayushman Bharat, particularly in the urban areas. Today I have been asked to concentrate on the urban area. The PMJ implementation is easier in the urban areas due to the availability of professionals, the utility of the beneficiaries, and the resource mobilization is easier, and the state and central government combined willingness to fund the treatment aspects. If you look at the weakness, there is a deterioration of the public health care, poor coverage and poor implementation of the bidirectional references of the beneficiaries. Look at the opportunity. There is a big opportunity for healthcare profession, as there are multiple levels of healthcare providers in urban areas such as nursing homes, polyclinics, etc. There are few challenges too. The utility of USHA, that is the urban essential, urban social health activists, because the urban essential activities is poor and unable to match the services of ASHA workers in the suburban and rural areas. They do much better work, and the USHAs are not utilized, we'll have to say. This is a weakness. A three-tier primary, secondary and tertiary healthcare is not well defined in the urban areas, and the non-availability of the beneficiaries during the working hours and holidays, and the presence of huge migrant population. Having seen the opportunities and challenges, we thought of some solutions as well as the presence of medical colleges, both public and private, in the said areas can adopt minimum one rural and one urban health and wellness center and one secondary healthcare hospital. We have 595 medical colleges in this country. In turn, they should be able to count the clinical data for the apex bodies. The residency program should be introduced for all health science programs and interns in line with the medical postgraduate residency program. I mean, namely the dental, nursing, physiotherapy, and other technical courses. Another solution we are suggesting would be a public and private partnership initiatives, which may also include corporate hospitals and institutions running the IT programs. Digital technology to improve the transparency and accountability can also be thought of. And another totally radical model, which I would personally suggest, would be what I call it as PCP model, that is public, corporate, and private colleges. I mean medical colleges. For instance, the contribution of them may be the government offering the land and the building. The corporate can take care of the infrastructure, capital investment, and the operational costs. The private colleges chipping in for the manpower and logistics. One may think that what I am talking is out of imagination. Frankly, it shoots out of the practical experience in our university under the Tata Trust Care Free India initiatives. The Tata Trust has supported for a comprehensive cancer facility with a 5-floor building and fully equipped with the state-of-the-art radiotherapy and nuclear medicine facility, which has been currently operational, run by NAPR deemed to be university. In a similar but extended way of running the facility is what I said as a PCP model, which I repeat, public, corporate, and private can work together. And government alone chipping in may not be possible. And that is what the COVID-19 pandemic taught both sides, both the governmental aspect as well as the private. For instance, we gave 50% of our beds from the university hospital for the running of the COVID pandemic time facility, care facility, quarantine facility we gave, and it was utilized by the governmental agency as well. So it is time that the government thinks about it and make it as a public, corporate, and private to work together. As a working model, I have suggested wherein a government body, a governing body can be made of, which can represent by the representatives coming from government, corporate sector, and private medical colleges, which will behave as a policy making and monitoring body. Whereas the advisory body will be more technical from the government and the private medical colleges, and the representative of the governing body as a part of the advisory body to advise and supervise the function. Thereby, we can inculcate that the belonging and longing for everybody, rather than it is the government which has to do it and we are mute spectators. If you look at, for instance, again, taking our own example, in Annapaya Deemed University, we have done cancer outreach programs through the government of Karnataka, Ministry of Youth and Sports. We have created awareness in 3 districts of Dakshin Kannada, Udupi, and Kodagu. Apart from that, the Udupi, along with Udupi district administration, we trained the Asha and Anganwadi workers for not only creating an awareness, but also to do the screening and early detection of common cancers like cancer cervix, oral cancer, and breast cancer. Apart from that, under NUHM, National Urban Health Mission, we are running an urban PHC, and in collaboration with the Mangalore Municipal Corporation, we are running an urban health center. And recently we have taken over the community health center of Ullal, which is close by, and we have started running it. During COVID-19 pandemic, the ICMR approved testing facility was first of its kind in this Dakshin Kannada. We are having the first quarantine facility and designated COVID care facility to support the district hospital and the district administration. The outreach health services and camps routinely we do. Recently, we have been given the tribal project by the government of Karnataka through the Department of Youth and Sports, wherein they have asked us to conduct early detection and screening of non-communicable diseases in 5 districts of Karnataka funded by them. This experience, I am trying to say that saying whatever I am talking is not out of imagination. It's only an expanded vision, which we have already introduced here, wherein we can do in collaboration with the district administration and the government, we can achieve much more than doing independently. Not only with the government, but along with the NGOs like Rotary International and Rotary Mangalore, they have donated Seeing Our Work, the specially designed vehicle for reaching the rural public and other areas, wherein we can screen and early detect oral cancer, breast cancer, cervical cancer, diabetes, hypertension, and anemia. So we are actually giving you a working model, suggesting one for the thought process, which needs to be vetted and piloted. But no doubt, I still insist that the 595 medical college can be better used in collaboration with the public, that is government, and funded by in a proper way of governing the corporates, so that the cash flow, the funding, infrastructure, and the running costs can also be taken care of, whereas the medical college can chip in with their manpower and other logistics. This is what I would suggest in this forum, and it's open for your queries, and I'm ready for any clarification. Thank you very much once again for the patient listening and giving this opportunity to be a part of this program. Thank you.
Thank you, sir. Thank you for enlightening presentation and especially sharing your personal experience of your university in implementation activities regarding universal health coverage. So now we will move towards our second presentation. Again, it's my pleasure to invite our second esteemed speaker, Professor Prabha Shankar Shukla, Honorable Vice Chancellor, Northeastern Hill University, Shillong. Sir is an eminent scientist in the field of agriculture, specialized in seed science and technology, with a track record of advancing social, economic, and cultural development. Professor Shukla, sir.
Yes.
Professor Shukla, sir has over 42 research papers, 50 articles, 17 book chapters, and 5 books and manuals. For his outstanding contribution in the field of agricultural science, sir has received various awards and fellowship, including fellowship in IARI, Effective Communication in Science and Tech Award, Shatabdi Samman by Vigyan Parishad Prayag, and Outstanding Scientist in Agriculture. These are only few among the many. He has guided more than 20 master's students and 6 PhD scholars during his academic journey. And in addition to strengthening the link between the education and research in his various roles, sir has led large changes in programs, work to further equality, diversity, and inclusion. And he's a strong proponent of driving the digital and online learning agenda. It's our pleasure to have you with us, sir. I welcome you, and to start your, sir will be delivering the talk on investing in strengthening healthcare systems. Over to you, sir. Thank you.
Okay, thank you. Bring up the screen.
Yes, now you can share the screen, share your presentation, sir.
I'm audible.
Yes, sir, you're audible, sir.
And
The
also
presentation
the my slide is visible.
Yes, sir, your slide is visible, sir.
Okay. So Sri M.K. Rajgopalan, Chancellor, Sri Balaji Vidyapeeth, Professor Subhash Chandra Parija, Vice Chancellor, Sri Balaji Vidyapeeth, and the first lecture in the first session, lecture delivered by the Professor Vijay Kumar, MB, Vice Chancellor in Rappa University, Mangalore. And he already delivered a very good lecture on Ayushman Bharat, and even discuss each and everything which is related to jo hai Ayushman Bharat. And the last Professor PKR, moderator of this program. So with this, I would like to start my presentation on investing in and strengthening in health system. As we are aware about the health and the health system of the country, I would like to start my dilemma with the shloka of health is wealth, or another thing is शरीर माध्यम खलधर साधनम। इस उक्ति में कवि कालिदास का कथन है कि शरीर ही सभी धर्मों का साधन है। A healthy body always has a healthy mind, and without the health, even we cannot live our life in this beautiful earth. The overview of the health system, or I can say the Indian health sector, which is already going very rapidly, and also the infrastructure in the field of the medical and other is already increasing, and the health sector is growing strongly at the rate of 16% annually, and modernizing, and cannot keep the pace with the regular demand, and demand for healthcare will continue to dwarf domestic supply out to 2035, and demand will be driven by the population, and we know the situation of our country's population. We are going to surpass the China in 2023. So the burden is always increasing, and we can also say the burden and the infectious diseases is also rising, and the medical infrastructure does not cater to the market, and India has 1 hospital bed per 1,000 people compared with other sectors, and the big public healthcare provision and low levels of public expenditure have been resulted in a reliance on the expensive program, and India has substantial policy ambitions to significantly improve its health sector, and India's national health policy is also even create an ambitions among the population of the country. India is also expanding public expenditure by the federal government and doubling the use of public facilities, aligning its standard with key international partners, and also attracting the people, attracting the investors to invest in this sector. And the National Health Protection Scheme is a bold step which is fully implemented and could become the largest government health insurance program in the world in terms of the number of households covered in this area. And this is also the health system, health, wealth and social well-being are a triangle relationship between the health system, health and wealth, and the societal well-being. And if the health system and the impact of the health system, we know that's why the country's people is suffering in up to some extent. And finally, I can say all the 3 elements means health system, health and wealth elements of the outside triangle in the figure contribute to the fundamental goal of social well-being through a combination of pathways, and improve health as a benefit in its own right. The improvement wealth, it creates directly and indirectly, and the security and social protection offered by the health system. And already the previous speaker discussed in detail about the Ayushman Bharat. I just would like to the financing track and the continuous developmental goals of our country after the joining as a chairman of the G20 presidency. In G20 presidency, Indonesia, Italy, and Brazil, and South Africa, and you just see about the India, so India is leading, and this is one of the most important goal among the जो है 17 goal of the जो है G20. Health is also जो है one of them for the overall the sustainable development, and international financial जो है architecture or infrastructure group जो है sustainable financial working group of the जो है and our global partnership of the जो है financial inclusion or joint financial health track system. And overall, I can say after joining the or receiving the post presidency of G20, our government, or I can say the Prime Minister of India, is giving emphasis on this sector. India health sector and the making the healthcare, some are accessible and some are accessible and some are not accessible, and some are affordable and some are not affordable. So with the making of the health sector, government is continuously even increasing our the IIMs, and the goal of the government the goal of the government is to establish the one medical college in the every district, and also the affordable and quality generic medicine under the PM Jan Aushadhi Kendra, and also the E-Sanjeevani help patients remotely consult medical professionals. As previous speaker mentioned that the 86% of the rural people and 82% of the urban people are not in position to assess the health center. So I hope that the government is already doing the good work in this sector with the Ayush reviving India traditional medicine system also in the form of the National Ayush Mission, and upgradation of the 300 plus hospitals and 4,900 dispensaries, and WHO Global Center for Traditional Medicine being set up in the Jamnagar Gujarat, and also to harness the potential of the Indian traditional medicine for public health and the planet. And all of you are well aware about the Northeast. Northeast is also very rich in the biodiversity. Even the tribal population of the Northeast is well aware about the Ayurveda system. But due to the lack of the lack of the communication, and also due to their traditional languages, and lack of the translation of the languages from Khasi or Garo or Jaintia into the national languages or Hindi or English languages, this area is also even untouched. So with the Ayush mission, government is trying to even conduct a kind of relation with the Ayush center, and which is already situated in the Shillong. Another thing is, as per the latest estimates by the United Nations, nearly 3.99 trillion trillion is needed to achieve the Sustainable Development Goals, SDG goals, by 2030, and more than double the current funding of $1.4 trillion dedicated towards the SDGs from the domestic and the international sources. And one of the key challenges of the SDGs era is the channel more private investment and resources to the countries and the sector that need it to the जो है most and standard chartered SDGs investment map estimates need for investment worth of 2.64 जो है USD trillion to achieve the SDGs in India, and offering the private sector an opportunity to invest US dollar $1.12 trillion by जो है 2030. And while the health ministry plans to boost India's public health जो है expenditure to 2.5% of its gross domestic product, mean GDP, up to the by 2025. 2025. And in the recent years, so this has remained within a narrow band of 1.02 to 1.28 of the GDP so far. Another thing would like to mention the India's unique accessibility and affordability and challenges can be addressed by the innovative healthcare solutions. But for this to happen, a conventional healthcare funding will need to be added by the innovative funding method and ideas. A tri-sector collaboration between the public, private, and philanthropical capital is thus option which could help unlock the funding challenges of the Indian health sector. And the COVID-19, a wake-up call for the healthcare sector, and is already strengthening in India. And yesterday, all of you also even got information by the television and others, due to lack of the infrastructure in the China is even suffering with the COVID-19 virus. But in between, our country, or we can say with the effective management of our Prime Minister, our population, or the citizen of country are less affected in comparison to the other countries. To understand the various things and blocks of the healthcare, and which is based on the WHO, the health system frameworks need to be again strengthened to face the future problem of the country. Another thing, the different sector who is already even investing in our country, the whole World Health Organization building the building blocks framework, and also the World Bank and Harvard's control NAPS frameworks, helping our country to develop the health infrastructure for the benefit of the Indian citizen, as well as other citizens, other people who belong to other countries. And next thing, that the Harvard World Bank flagship health 5 control knobs in the health sectors, and that knobs is already in the field of the financing, payment, organization, regulation, and behavior. So in this, these are the some are the health system control. These are the control knobs of the health system, and this control knobs, the mechanism of the fund of the health sectors, and the payment. This control knobs will provide. This will provide the existing systems and organizations and regulations. These are the requirement to impose by the either direct or the behavioral base of the healthcare providers and the organization. And behavior, this control norm influencing the behavior of the providers and consumers through population based interventions, since these are जो है grounded in social and cultural structures and therefore influenced by the benefits, perceptions, attitudes and the cultural norms. And the WHO जो है health system framework and system building blocks and overall goals of the outcomes, and these are the 6 building blocks: service delivery, health workforce, health information system, access to जो है essential जो है medicines, financing, leadership and the governance to assess coverage and quality and safety. So to improve the health, to improve the overall, to achieve the goal, improve the जो है health, improve the जो है health system and which is responsible and also the social and financial risk protection. So with the insurance of the जो है and with the policy of the government, the social and financial risk will be covered by the जो है insurance companies. And another thing is improved efficiency. So in the improved efficiency means the country is even producing the जो है and establishing the system in different at the district level or the जो है state level. So with this I think the population of the country will be benefited. And in 2007, WHO published a framework community known as the WHO building blocks and guide to common conceptual understanding of what constitutes a health system in order to go about strengthening it. And according to this framework, 6 building blocks constitute a health system, and these building blocks are already discussed with you about the service delivery, then health workforce or human health workforce means human resource, and information means data and data collection, and also after collection management of the data and even presentation of data, and the medical जो है products, vaccine and जो है technologies, then the financing and the leadership also playing an important role to implement जो है different kind of जो है policies and the governance. So hopefully I can say at this time the leadership of our country is really very good in comparison to the जो है other countries. Another thing is जो है investment opportunities in the healthcare section. So India's healthcare industry comprises the hospitals, medical devices, equipments, health insurance, clinical trials, telemedicines, and medical tourism. Major segment on the supply side of the India's health care sector and are जो है we can even study in this be the hospitals. The government can invest, even private players also जो है investing in the जो है healthcare sectors, and government always trying to जो है even develop the जो है medical colleges at district level, and the private sectors also developing the nursing homes, mid-tiers and top tiers private जो है hospitals. Pharmaceuticals in another area of the investment, including the manufacturing, extraction, processing, purification, packaging, chemical materials for use as a medication for human or the animals. Next, third is the diagnostic, and diagnostic comprises the business and laboratories that offer analytical or diagnostic services, including the body fluid analysis. And private sector, at this time we can say, or I can say, and the maximum private players are investing in this area. Medical equipments and supplies, includes the establishment of primary manufacturing, medical equipments, supplies, surgical, dental, orthopedic और जो है ophthalmological laboratory instrument, but through startups, some companies are trying to even produce the जो है medical equipments in our country. But as I know, more than 80% equipments are we are importing from the other countries. So this is also one of the best area for the investment. And medical insurance, we already discussed about the different kind of health insurance and medical reimbursement facilities. And the government is also even trying to reach each and every citizen of this country for the medical insurance purpose. And the one areas, the telemedicine areas, even in the drone, also playing an important role to distribute the medicine from one places to other places. And in telemedicine has enormous potential in meeting the challenges of healthcare delivery to rural and remote areas, besides several other applications in education, training, and management in health sectors. And the country health sector is already growing, and this is a common growth rate of the growth trend of India's healthcare sector in US $billion, which are in 2008 and 9. This is the only the $45 billion was investment, but at this time, February 2022, the data says $372 billion investment in healthcare sector. And India Brand Equity Foundation retrieved in December 5, 2020 of this data. So this data shows that this sector growth is exponential, approximately 22% annual growth rate of this sector. Another thing is employment generation potential of the healthcare sector in India, and we are well aware about the things. No doubt we are going to surpass the China in terms of the total population. Definitely this sector is a very rising sector and direct jobs in India's healthcare sector. And this is already the exponential growth in the health and allied sectors of the health in the field of pharmacists, nurses or midwives, dentists, specialists, and also the doctors are allopathic or homeopathic or Ayurvedic doctors in all the areas. So this is already the one of the best area for the investment. Business investment climate, and India improve its easy to doing business ranking from 142, it was in 2014, to 63 in 2019. And India has also been ranked number 1 in the Central and South Asian region. And also improvement of 33 position from number 81 globally in 2015, number to 2000 at this time 48, or this time in 2022 it is 48. So this is exponential, and India has been one of the fastest growing emerging economies over the last 2 decades, receiving large FDIs inflows, which have grown from 2.5 billion in 2001 US to and the healthcare FDIs, USD drugs and pharmaceuticals 16,501, and hospital and diagnostics the 6,727, and medical and surgical appliances inflation $2,130 billion. And the healthcare sector has received the
Excuse me, sir.
yeah.
Sorry for the apologies for interruption, sir. Just requesting to, we will keep the session till 3:30 because we have another speaker. Yeah. Thank you, sir.
Yeah, I have 5 minutes. No, within 5 minutes, I'm just going to over the
Sure. Thank you, sir. Thank you.
Oh, yeah. And the healthcare sector has also received the highlighted interest from the different investors over the last few years, with the transaction value increasing from 94 US billion dollar. And India's health policy, and we are well aware of the national health policy 2017, and India's national health policy aims to increase the government spending on health to 2.5% of GDP by 2025, and also promoting the teleconsultation, linking tertiary care institution with specialist consultations, and schemes in the Atmanirbhar Bharat Abhiyan package for boosting the domestic manufacturing of the drugs, and production linked incentives scheme for promotion of the domestic manufacturing and critical payments. And this is an overall view of the financial incentives will given to the eligible manufacturers, and also the fermentation based drugs about 20%, and chemical synthesis based drugs 10%, and scheme for promotion of the bulk drugs parks, and the overview of one-time grant in aid, and also the incentive is not near about the 1,000 crore USD, and bulk drug park, and total financial outlay and tenure between the 2021 to 2024-25. Another thing that the experiment is the medical devices export and import from 2015-16 to 2019-20. This is also already increasing. Export also increasing, but it is already less than the import. So there is a need of sustainable or continuous efforts in this area, and the consumable disposable needles and syringe, diagnostic imaging, MRI or X-ray, and orthopedics area. Another thing is that several factors make the India's popular in medical tourism. Medical tourism is also one of the best area, and this area is why it is very important in our country. Our country eye system is very cheaper in comparison to Thailand, Malaysia, Singapore, Turkey, and South Korea, and this is a comparative presentation of the different countries. Another thing, by early December 2020, over 1 billion teleconsultation had taken place through Sanjeevani across 550 districts of the India. And another thing, the National Health Mission, and in the National Health Mission, the adoption of the Indian public health standards, quality standard, skill gaps, hospital management, and quality improvement program under the NHRSM, NRHM schemes. And how can we blend the financing to build, strengthen, and transition in the health status, investment attractiveness, and approaches to the blended finance system. Another thing is, in the last, I would like to say that the health system of the India are even day by day strengthening, and hopefully in the future, after overall development of the medical colleges at district levels, our country will be in position to provide the health facilities to all the citizens of the country. With this, once again, would like to thank the organizers and also the moderator for providing me the chance. Thank you, Kublai and Mitela. Thank you. Over to you.
Thank you, sir. Thanks a lot for your elaborate presentation on the importance of health system strengthening. Especially you touched upon the vital aspect of health infrastructure, budgeting, and the costing of finance, because those are the key aspects which contributes towards a universal health coverage in providing affordable healthcare.
Yeah.
Now we move on to our next speaker. It's my honor to introduce our third speaker, Professor Subhash Chandra Parija, Honorable Vice Chancellor Sri Balaji Vidyapith Puducherry. Sir is an eminent academician, erudite microbiologist, researcher, a keen votary of medical education, and an able administrator. Sir was a former director, JIPMER Pondicherry. Professor Parija sir is author of 16 books and has more than 400 research papers in various national and international reputed journals. Sir has been listed among the top 2% of the scientists globally in the field of tropical medicine. Sir is an expert member in Food and Agriculture Organization and WHO on foodborne parasitic diseases. Sir has received the prestigious Dr. B.C. Roy National Award in the year 2003 for his significant contribution in the development of medical microbiology. Sir is also the founder of Indian Academy of Tropical Parasitology, and he has been conferred with various fellowships, including FAMS, FICI, FABM, FAMSA. And very recently, sir has been awarded with the S.N. Bose Birth Centenary Award for the period of 2020-2023 for his immense contribution in the area of molecular parasitology, parasite serology, and immunology. It's our pleasure to have you with us, sir. And I welcome you. And sir will, Professor Parija sir will be delivering the talk on sustainable healthcare through telemedicine. Over to you, sir. Thank you.
Good afternoon. Am I audible, Doctor?
Yes, sir. You are audible, sir.
It's my immense pleasure on my behalf of our big family of Sri Balaji Vidyapith, SBV, and our respected Chancellor, Sri M. K. Rajgopalan, to extend a hearty welcome to you all on today's interesting webinar on building a healthy future for all. At the outset, I must thank speakers, Professor Vijay Kumar, Vice Chancellor of Yannapaya University, Professor P.S. Shukla, Vice Chancellor of Northeastern Health University, Shillong, for thoughtfully contributing on various aspects of this building a health future for all. Today, coming to next 20 to 25 minutes, I'll share some of my thoughts on the important component of this theme, that is sustainable healthcare through telemedicine. Today's my topic will be sustainable healthcare through telemedicines. As we know, as been nicely shared by my previous speakers, the Indian government faces an uphill battle to meet the country's healthcare needs in year by 2030. Healthcare has been always a major challenge in our country because the country is home to more than 1 million people, 2/3 of whom live in hard to reach rural areas. Just meeting everyday health needs is a challenge, not to mention of treating rare or complex diseases. So the Indian government's goal of making access to care universal by 2030 will require extraordinary creativity. Universal health coverage means that everyone can access the health services they need without financial hardship, something most countries struggle to deliver. Digital health tools carefully implemented are definitely indispensable to ensuring that this goal becomes a reality. This includes a range of technologies like mobile phones, apps, and wearable devices to collect data and monitor patients remotely from remotely operated medical devices, teleconsultations, electronic health records, and artificial intelligence-based analytics for monitoring and diagnostics. COVID-19 pandemic acted as a catalyst for telemedicine and other digital health initiatives, from remotely monitoring health patients to providing healthcare consultations and for the people with chronic conditions. Before the pandemics, telemedicine was less common in India. Now we see that it could help India's needs for different purposes, for more skilled health workers, including doctors, nurses, and mental health professionals. In essence, we are in an age where the average consumers manage nearly all aspects of life online. It's no barrier that healthcare should be just as convenient, accessible, and safe as online banking. So I plan to present my talk with emphasis what we understand by digital health to achieve universal healthcare. In this context, what is vision of our country, digital health, and what is our national digital health missions, and what are the initiatives taken by Government of India on digital health initiatives, and in that background, what is the current scenario of telemedicine in India being extensively used or will be used for the treatment and management of the patients, and the platform that is being promoted, that is eSanjeevani telemedicine platform, and way forward, we look forward on this. When we think of Universal Health Coverage Day, every year on 12th December, this has been celebrated, which serves as an annual rallying point for advocates to raise their voices and share stories of millions of people still waiting for health. Call on leaders to make smarter investments in health and remind the world about imperative of UHC. So this year's campaign comes at a very critical time when countries across the world are rebuilding from the impacts of COVID-19 pandemic while facing many other crises such as natural disasters and conflicts. Theme for the year 2020, that is, build the world we want, a healthy future for all. It means that together we can build a world where everyone, everywhere can get the health care they need without being pushed into poverty because of having to pay for it. This is the goal that makes all other sustainable developmental goals happen. There are total 17 sustainable development goals which countries worldwide are aiming to attain by the year 2030. Each of these goals, which is good health and well-being, and target 3.8 focuses on achieving universal health coverage. After all, the goal of UHC is to achieve, to ensure the quality, accessibility, and affordability of health services. However, shortfalls remain in ensuring access to all who need health services and ensuring that they are delivered with the intended quality without causing any financial hardship to the people accessing them. This framework provides an understanding of health system performance gaps and how they prevent the intended coverage, quality, and affordability of health services. This cascading model illustrates how health system lose performance because of challenge at successive levels, each dependent on previous levels. Health system challenges such as geographical inaccessibility, low demand for services, delayed provision of care, low adherence to clinical protocols, and costs to individuals, patients contribute immensely to accumulated losses in health system performance. These shortfalls also limit the ability to close the gaps in coverage, quality, and affordability, and undermine the potential to achieve UHC. Vision of digital health in India was based on many activities. India undertook various initiatives in digital domain for efficient health service delivery. To give an example, to set up pan-nation telemedicine network, optimal use of IT, information technology, for pan-nation surveillance and monitoring of programs, efficient use of IT tools for capacity building and training, wide-scale deployment of IT tools for governance and information dissemination. Vision was to create a national digital health ecosystem that supports universal health coverage in most efficient, accessible, inclusive, affordable, timely, and safe manner, and a seamless online platform through the provision of wide range of data, informations, and infrastructure services, duly leveraging open, interoperable, standard-based digital system, and to ensure the security, confidentiality, and privacy of health-related personal information. It means by national launching of a national digital health missions that was launched on 15th August 2020 and partnering with citizens, doctors, and healthcare providers in creating a digital health ecosystem. There has been several recent digital healthcare initiatives in India that includes online services, for example, National Health Portal, online registration system, Central Drug Standard Control Organizations, SUGAM, etc. has been started. Enhance the mobile applications, for example, Vaccine Tracker, India Fights Dengue, etc. for tracking of various infectious diseases or non-infectious conditions. Another IT was installed for service delivery and tracking, for example, mother and child tracking systems, TB patient monitoring systems, and so on. For process automations, e-hospitals, Rakt Khosh, etc. also has been standard, and various other programs, including information system, surveillance programs have been operated, and standards and regulations have been also implemented. That includes by setting of National Digital Health Authority, EHR standards, and national identification numbers, and most important, to make a capacity buildings by starting of mobile academic training management systems for strengthening this telemedicine. And the most important that has been felt during last COVID-19 pandemic was the online consultation, and telemedicine proves a very important role for this purpose. For that, National Medical College Network, National Telemedicine Network, even establishment of SATCOM-based telemedicine network facilitated telemedicine works during this time. In this National Medical College Network, NMCN, in which 50 government medical colleges are being interlinked with the sole purpose of teleeducation, e-learning, and online medical consultation by utilizing the connectivity provided by National Knowledge Network, NKN. Under this initiative, a virtual layer of specialty, super specialty doctors from these medical colleges would be created for providing online medical consultation facilities to citizens that will be similar to OPD facilities, but in a virtual way through web portal. This would help patients from rural, remote, and urban areas to access doctors and specialists easily, even from their home location, through their smartphones, through government healthcare institutions, Also, e-classrooms are being set up at these medical colleges for sharing and streaming the important lectures, seminars. Another important network, that is National Telemedicine Network, has been envisaged to provide telemedicine services to the remote areas by upgrading existing government healthcare facilities in states. Telemedicine nodes across India are being created for interconnecting district health hospitals, private health hospitals, etc., district hospitals and medical colleges in every state for providing citizen-centric services. It's believed this network, TM network, will definitely start in synchronous with the rollout of other activities across the country. Establishment of SATCOM-based telemedicine nodes by Department of Space through the Indian Space Research Organizations had initiated a nationwide telemedicine program 2 years back last year in the year 2001 and provides TM systems hardware, software communication equipment, as well as satellite bandwidth for 384 hospitals with 60 specialty hospitals connected to 306 remote, rural, district, and medical college hospitals at various unreachable geographical locations, including Char Dhams and other important pilgrimage centers such as Amarnath, Ayappa temples, and Kedarnath, where the quantum of pilgrims are massive for health awareness in the situation for screening of non-communicable disease and for providing special consultations to the devotees visiting this site will be of immense help for those visitors. Initially, the telehealth services are operationalized in the field of medicine, orthopedics, respiratory, and cardiology disciplines. All these telemedicine nodes are now part of ISRO National Telemedicine Network and could also be serviced by any of the specialist node across the country like PGI Chandigarh, SGPGI Lucknow, JIPMER Pondicherry, and AIIMS New Delhi, etc. eSanjeevani telemedicine platforms provides an opportunity for a doctor-to-doctor telemedicine service under Ayushman Bharat Health and Wellness Center scheme of the Government of India to provide general and specialized health services in rural and isolated communities. This service is based on a hub and spoke model, that is eSanjeevani AB HWC, that enables virtual connections between the beneficiary, that is along with the paramedic and generalist, at the spoke, that is SWC and doctor specialist at the hub that includes tertiary healthcare facilities, hospital, and medical colleges. This really facilitates real-time virtual consultation from doctors and specialists at the hub with the beneficiary of that scope. And this is a patient-to-patient telemedicine service that enables people to get outpatient services in the confines of their homes. It is available as a mobile app for both Android and iOS-based smartphones. eSanjeevani is an example of the Make in India initiative as it has been developed indigenously by the health informatics groups in Mohali Branch Center for Development or Advanced Computing Center, that is DSC. We know that telemedicine and other digital health technologies are not the ultimate, but definitely we are sure if done right, they can help make the healthcare universal in India. If done wrong, it will only further fragment and make the healthcare system even more equal. To re-emphasize the telemedicine, when delivered effectively, it can broaden healthcare access and make it sustainable across the populations in our country. Just I like to share with you a survey on telemedicine awareness and acceptance. This survey, which was conducted, it shows that public awareness and acceptance about telemedicine is very much low in India when compared to US or China. Telemedicine, in essence, has bright future, is expected to cross $5.5 billion by year 2025 in India. Is believed it will reduce the time of consultation and improve the quality of healthcare services in rural areas, removing many of the infrastructural challenges. And the telemedicine market in India is expected to reach $5.4 billion by the year 2025 with CAGR of 31%. So to conclude, dear participants, given the scope of India's plan and ambitious experiment in the field of digital health, telemedicine will definitely help in revamping the healthcare systems and will pave way to provide a sustainable healthcare in India in near future. Thank you. Thank you very much for your presence here.
Thank you, sir. Thank you for that elaborate presentation and highlighting on the key aspect of telemedicine, which addresses the issue of accessibility of healthcare, which is one of the corner principle for universal health coverage. So we are here at the end of today's important webinar, and I would like to express my gratitude and thanks to all the eminent speaker. My special thanks to Professor Vijay Kumar sir, who was keen to accept the invitation at a such a short notice, and he elaborated and shared his own personal experience at his own university in context to universal health coverage. Thank you, sir. I'd like to thank Professor Shukla sir, who also within a notice of just 1 day, he accepted our invitation and shared in detail about the key aspect of healthcare costing and the importance of cost-effective health services. Again, a key aspect of universal health coverage. Thank you, Shukla sir. And lastly, I would like to thank our Honorable Vice Chancellor, Dr. Parija sir, for sharing that, who not only presented with the key aspect of universal health coverage, but is also a drive, a motivator for all of us, and who has been behind organizing a motivation for us to organize such important webinars. Past so many, almost more than 30 topics, 30 webinars have been organized, which enlightens all of us in various key topics. Thank you.
Thank you very much. Can I share? Can I
Please.
just comment? Thank you
Please,
very
sir.
much, Professor Rohan Kumar, for your excellent moderation of the webinar. I take this opportunity to again thank you profusely my co-speakers, Professor Vijay Kumar, Professor P.S. Shukla, and all the participants participating in our university seminar, university webinar being held in every second Wednesday of every month. I wish you all the best for a happy new year 2023, and we'll meet in the first seminar on the year 2023 in the month of January. Thank you. Thank you very much.
Okay, thank you. Thank you, the Chancellor of the university, also the Vice Chancellor of the university, for build up a kind of relation between the Sri Vidyapith and NEHU, and hopefully it will be continued 23 also.
Yeah.
So thank you.
Thank you.
Thank you. Yeah.
Thank you very much, sir. From my side, thanks a lot.
Thank you.
Thank you very much.
Thank you very much. We enjoyed it. Again, we'll make it next year.
Thank you all for participating. There is one more announcement from Sri Balaji Vidyapith. There is an academic feast which we have planned for the month of January under our driving force of Sri Balaji Vidyapith, our Honorable Vice Chancellor Dr. Parija sir. We have planned a 3 days academic event, which will have 25 workshops, 16 conferences, and 6 CMEs and symposiums. The early bird registration closes on 31st of this month. So please hurry up for registering in order to avoid disappointment. The same flyer will be sent to all the universities throughout the country. Thank you all. Thank you.
Thank you.